Okay, excellent.
And talking about being outdoors, remember, playgrounds are closed.
Right.
And it was noted, and we observed parents and grandparents and people taking children to the playground. Those playgrounds are closed. Do your civic responsibility and stay away from the playgrounds.
I had a question kind of follow up to that was texted to me. We've heard to social distance, but what about kids playing outside or visiting with neighbors at a 6-foot distance while outside? We talked about this a little bit, but I know, as a parent, this is a question that a lot of people have on their minds.
There is a way to socially distance your kids to play. They can get on the driveway and all do, driveway chalk by themselves. Two moms or two dads don't need to congregate right next door or right, shoulder to shoulder to each other. We can keep a comfortable distance and have those kids at least communicate with each other and be out there. Again, this is not a prison sentence or a jail sentence. This is just to get people thinking about their social responsibilities to stay their comfortable distance away from everybody. Little kids can't hug. They love to run into each other, and kids are dirty little creatures, as we all know. So you have to remind them as a parent, be a parent. Keep them away from interactions directly. But yes, they can go on bike rides together. You just have to continue to preach about stay away from little Johnny, little Susie, and keep a nice distance. And I have a 4-year-old myself. She understands there's a virus. You can teach these kids there's something dangerous out there, but you can't see it. So stay away from it.
Yeah. Absolutely. Next question, again, Dr. Bracken, is hydroxychloroquine, maybe I said that right, azithromycin, effective? And if so, when will it be available to patients?
I could probably spend the next 9 hours talking about treatments with Dr. Patel and myself, options that are out there. Hydroxychloroquine is a malaria drug. It got a lot of press. There are animal studies. There are laboratory studies that say, there is some benefit to it early on in the disease stage. But COVID-19 has a preliminary phase where people have a lot of upper respiratory tract infections type of symptoms, and that leads up to about 7 days or so. Then you fall into week 2, and that's where we see this dramatic downturn in a good percentage of people. Once you get past that dramatic downturn and people are critically ill, they're in the hospital, we see less effectiveness of the hydroxychloroquine. The problem is there's no national stockpile of hydroxychloroquine, and it's all getting shipped to areas of the hot spots in the world, and that's great. We don't have to go out and start stockpiling hydroxychloroquine for ourselves. There is a role. It's a very high interest in research right now. The azithromycin, in addition to it, came from a French study that's been a bit debated whether or not there's much benefit in adding the azithromycin. But please, if you can speak to your health providers, you can call the union hotline as well and talk with the nurses about, do I need to get on this drug? And trust the information that's out there from the CDC and the ISDH on it.
I'd like to emphasize there is no proven drug to cure this.
Right.
Our care is still supportive. We meet as a group of healthcare providers in multiple subspecialties, as I said, every few days, including infectious disease, pulmonary critical care, hospital medicine, and we try to come up with a wise strategy in an area that nobody really knows the answers to. So we are discussing the data that's coming from China and Spain and Italy and even in the U.S. from Mass General at Harvard and in New York. I've personally been on the phone with providers in New York and Boston to try to determine what best practices are. And right now we're still kind of, shooting in the dark, really. And so we do try to utilize these therapies to the best of our abilities, but they are in short supply. And so the key really is to just not get sick in the first place.
Mm-hmm. Yeah. Absolutely.
Yeah, an important point. All of our treatments are unproven and experimental. And I read an article of someone coined the phrase, we're trying to build the plane that we're currently flying. And that's really what it is that we're doing. So.
Okay. Another question, this is from Daryl in Jasonville. This could go to either of the doctors. If a mosquito bites someone with coronavirus, then can the mosquito then transmit the virus?
No.
All right, that was easy enough. All right.
I'm sorry, I'll expound upon it. It's a respiratory-borne virus. It is not a blood-borne virus, and mosquitoes obviously siphon blood from you, so no, it cannot be transmitted that way.
Okay.
That's known.
Good to know. 'Tis the season. Brendan, question for you. Is there anything the public can do for the staff and first responders, such as a drive to raise funds for medical supplies or financial aid for workers?
We actually had an exercise this week where there's an organization that wanted to make care baskets for police and firefighters. And as we've all probably heard, the fire stations are locked down. And, you know, one of the worst things you can do, it's a good-hearted effort, but if you're taking something and bringing it into that environment, you're possibly bringing contamination within. So I absolutely do not recommend making care baskets for providers right now. If anything, you know, your moral support, letting them know that, hey, we care about you. One thing we have to think about is who takes care of these people that are taking care of us. And that's something that, you know, we rely on these providers to help us in our time of need. But when they get home, who's there for them? So, you know, reaching out by a phone call, a Facebook message, or something to them directly saying, hey, thank you, I care about you, I appreciate it, I think would go miles. As far as finances goes, choose an organization that's near and dear to your heart. Whether it be a faith-based organization, the United Way has a fund going now. I think the Community Foundation does. Those are pros that work with agencies within the community to help distribute funds where necessary.
Yeah, absolutely.
May I add, there has been a shortage of blood nationwide
Good point.
as
Very good point.
donors have been socially isolating themselves. Blood banks throughout this country, in the Wabash Valley as well, have made efforts and are doing all the appropriate social distancing and protection for potential donors. So if there's nothing else you can do, donate blood.
And it goes back to what Dr. Brucken said about the mosquito. This is not a blood-borne disease, because we had a question that came into our office, are they screening the blood at blood banks? And it's not a blood-borne disease.
Absolutely. We have one more question that we'll get to, and then we'll do some kind of closing remarks before our live section ends. Let's go to both the CEOs. Do the hospitals have backup plans in place if the hospitals become overcrowded?
Okay, Mayor, is it your turn or my turn?
Nathan.
Certainly, I think all healthcare organizations have been working on this very diligently over the last couple of weeks. At Regional Hospital, we certainly have, as I mentioned, and I know Steve has mentioned it as well. You know, we are preparing for the worst within our capabilities. I applaud Steve and his team at Union Health for reaching out and working together with our organization to make sure that we are together able to handle this safely to the best of our abilities. And once we get beyond our best capabilities, we'll have to reach out to other partners around the state and perhaps even in neighboring states to help out as well. So the short answer to your question is yes. We just hope that we don't ever get to the point where we exceed the capacity that we're planning for.
Absolutely. Thanks, Stephen.
Nathan said it well. I just add, we have seen the models. We're getting models on the surge from the state, and both of us feel that we have the capacity to handle it, yes.
Excellent. Good. Well, right now, before the live portion of the program ends, we are going to continue this discussion on the Vigo County Facebook page as well via their live stream. But I do want to, again, thank the Vigo County Health Department for organizing this. We're going to turn it over to our panelists to provide a couple of closing remarks. And again, if we get cut off, this will be continuing live on the Vigo County Commissioner's Facebook page, I believe. So, Dr. Bracken, I'll start with you.
Thank you. I'll try to keep it brief. I get a little long-winded. Please understand, we have a 2 to 3 week interval. It's our last window. It's our last window of opportunity to do what we can to shut down the spread of the virus in the community. You're not going to see the numbers. You're not going to see the sickness until 2 to 3 weeks later, when we can potentially be overrun in our healthcare delivery system. We are prepared as we can be. The statistical waves, the models that are coming they are frightening, but this is a time to be responsible socially. Wear your mask, stay home, be very kind to your neighbors as well, and do what you can. Do your part, please.
Yep, absolutely. Dr. Patel?
To echo those words, stay home, be safe, take care of each other, take care of us, and just please heed this warning, because this is our chance to prevent unneeded sickness and death.
Joni?
Take it seriously. This is our last chance, or could be our last chance. We're at a very narrow window, echoing what they said. And if you don't step up and do your part, if we don't step up and do our part, which is staying home, if you have to go out, listen to go over all those steps that I talked about of, wearing the mask out and all, being hypervigilant. This is going to be life or death. Stay home.
Absolutely. Steve?
Sure. I'll tell just quickly, viewers in the Wabash Valley, I think of those that may not get the flu and how their health is. And I would tell you, we live in an amazing community that cares. The faith-based community and the faith foundation that this community has, I see exhibited every day. We had a patient just a couple of days ago, and obviously we haven't talked about our visitation guidelines are very stringent right now, where you can't visit. And we have a patient with the COVID-19 now that their employees that the individual worked with came and asked to meet in the parking lot and asked their caregivers if they could come out, met them in the parking lot and prayed for them. That's the type of community we have that turns to God, that realizes this is a spiritual part of what's here and consoles them. And I'm thankful to live in a community like that.
Absolutely.
I'll just echo what the other experts in the room said. Stay at home, heed the warnings, take this seriously.
Yeah, absolutely. Brendan?
You know, Kristen, as an elected official, we're supposed to give calming words and make everybody feel good about this. This is scary. And I've been trying to think of something that would be great to tell everybody to help inspire them. And I struggle with it because we are struggling every day. We're reactionary. We're trying to do what we can. But I will assure you that your elected officials in Vigo County, the employees, city and county, we're working for everybody's best interest. And, you know, this is tough. It affects all of us. And I don't know what else to say other than we will get through this.
I agree, and I think that's in times like this when community leaders can come together and, give that message out consistently, stay at home, social distancing, and in the next few days, I think there'll be a campaign to ask all of those community leaders, including the mayor, commissioners, everyone, to really echo those sentiments, because as a community, we can make it through all of this.
Sure.
So we do have a few more questions. I'll go ahead and start asking those, knowing that we'll probably cut away on the live feed. Joni, something that we didn't get to is what happens if...
Now, hopefully you have taken away a lot of important information tonight. News 10 has coverage you can count on around the clock on our website and on our News 10 app. You can download it from your app store by searching WTHI News 10. As we end tonight, we leave you with a message to stay safe, stay healthy, and stay home. It's part of our All in This Together campaign. You can download a coloring page from our website, then send us a picture of you holding it. You see one there. All of this is on our website. Again, it's WTHI-TV.com. We'll see you back here at 10 Eastern on MyFox 10 and 11 Eastern on News 10 Night Watch.
This has been a News 10 special report. The coronavirus in the Wabash Valley. Your questions answered.